Hi everyone, my name is Kisha. I am a medical social worker, and today I wanted to chat with you briefly about what you can do with a degree in social work. So a lot of people think social work is just you working at CPS and taking kids, and it's a lot more than that, and you get paid a lot more than that. So you can be a director of a let's say like a program or a facility if you want. There's programs that have a program doing social work and your MBA, which is a master in business administration. So that's you going into the directing, creating roles, thinking of policies, the budgets, things like that. You can be a therapist. You can work at a drug rehab facility, a psych facility. I work at a hospital. So there's many different things that you can do. So I would say look into it if psychology is something that you feel like you're inclined to do or want to do. So my role at the hospital is what I do. I'm doing discharge planning. So that means if you have a relative that comes into the hospital or you come into the hospital and the doctor has ABCD that he wants you to do before you're cleared to discharge, then it's my role to fulfill ABCD. So if you need to go to rehab, I arrange that for you. If you need some type of medical equipment, usually for older people, it's like walkers, wheelchairs, bedside commodes, a cane, maybe like a prosthetic leg or something if you had an amputation. If you need like IV antibiotics to go home, I arrange that. If you need home health, so that's when you have rehab at home, or you need a nurse to come to the house to help you with something. Usually it's like dressing, bathing, also doing rehab, medication management. I do that as well. If a patient is here at the hospital and they need to be transferred somewhere, let's say to a higher level care at a bigger hospital, then I arrange that transfer. I set up the transportation, I call the transfer line, I let them know what the patient's diagnosed with, what the issues are, why my hospital feels like we can't arrange that. We also talk to families if they're, let's say, someone's in ICU and they're not responsive. Then we talk to the families about, okay, what are their wishes? How do you want to proceed? Do you want us to resuscitate this patient? Does this patient need hospice care? Do they need to go to another facility for long-term care? So things like that. I've also worked at a dialysis facility. So I help set up patients to have dialysis. So I do the intake process. That is like signing all the paperwork, enrolling them in Medicaid or Medicare, getting them started. So their shift, their chair times, same thing doing transportation if they live at a rehab facility or nursing homes, what most people know it as. Then I set their transportation up to get to and from their treatments. Also what I did was get them on the kidney transplant list if they needed, they want to have a kidney transplant so that they no longer need dialysis. Then we enroll them into that. So there's many things you can do with a social work degree, especially in the medical field. There's a broad range of things. So I would say definitely look into it. Just know social work is way more than CPS. That's not the only thing. In fact, CPS is a caseworker, not a social worker. So two totally different things that people seem to get mixed up. As far as my schooling, so my bachelor's degree is in psychology and then master's is in social work. So it took maybe like 2 years to complete. And then you have to have I'm so going blank. 2 internships. You have to do 2 internships. So my internships were at Big Brother, Big Sister. And then I did an internship at like a low-cost community agency inside of an apartment complex where I was able to set up the after-school program for the kids. And I was able to say what I wanted, when I wanted it, what kind of activities we were going to have with the kids, and help the parents apply for jobs, set up their resumes, things like that. So it was a really great opportunity. I would definitely suggest doing social working. The only thing is, even after you get your degree, you have to take a test to be a licensed social worker in the state of Texas. Without that, you can't do pretty much anything. So the test can be kind of hard, can be expensive, but it's worth it. And once you pass that test and you're certified, you can do anything that you want, and the pay is definitely worth it. So if anyone has any questions, you can tell Ms. Summerhill to give you my email address, contact me. Any questions regarding schooling, the route to go, jobs, anything like that, I'm here available. Just let me know. and everyone have a good day.